At this moment, as a voice that represents the patient community, is a moment of immense pride for us because for the first time in the history of our country, where the medical fraternity and the patient body came together to publish a research paper. It doesn't end there. We also presented the research paper at a national forum. And to share a few words on this paper and this groundbreaking collaboration, I take great pleasure to welcome on stage Dr. Arvind Canchi to please present the same.
Good morning, folks. It gives me great pleasure to let you know that the patient community headed by the Kidney Warriors Foundation and Mrs. Vasundhara Raghavan approached some of us nephrologists to see whether they could get into doing some research. And quite frankly, this is something that we put up. And this was a survey of patient-reported experiences and perceptions on prescription practices in nephrology, and it's a mixed method study. And a few of us nephrologists were involved. Many patient group participants in this research. And the most important thing here is that this paper was actually presented by Mrs. Vasundhara Raghavan as a podium presentation in the Indian Society of Nephrology conference, ISNCon 2026 in Lucknow. That, I think, deserves a round of applause. Next slide. I'm going to quickly go through and say that 708 patients participated in the study. It was a mix of dialysis and chronic kidney disease patients. 79% of them was male. Now, I'm not going to go through the entire study, some salient points. And what is there in red matters. 28% only of the patients get the purpose of the medicine explained. 14% only get the side effects explained. So it's very important. It's actually a lesson for us nephrologists looking at this study, saying that we do tell the patient, what the medicine is about, why we are giving it, but we need to go further. We need to bridge that gap where we explain the purpose, why the medicine is being given, and what are the side effects, and so on. Next slide. And these are some patient voices, and very important to listen to patient voices. I don't understand why I take each tablet. Side effects scare me because no one explains it to me. I don't know when to stop it or when to continue it. And the most important is I feel awkward asking questions, and that should not be there. My strong suggestion to the patient community is you should come forward and clear your doubts with the doctor. That would be the best way that you will probably get the best treatment that you would. Next. So the study found that while core prescription details were well communicated, improving prescription practices like explaining the side effects, cost of medications, all of this could enhance adherence. Patients who hesitate to question their doctor are twice as likely to be dissatisfied and non-adherent. That's an interesting part of that study. Next slide. So clear prescriptions improve trust, safety, and adherence. Clarity in explanation will make patients compliant. Next. And now the next research plan is to look at protein in the diets, or rather the lack of it, prescribed to our patient population. Again, a round of applause to Mrs. Vasundhara Raghavan for initiating the study and presenting it. Thank you.
Thank you very much, Dr. Arvind, for presenting that research paper. And I'd also like to take a moment to say thank you to Dr. Arvind again, because he's been a very, very important member in the Kidney Warrior Foundation, one of the individuals heading the prevention task force, and he's always had our back in every step forward. Thank you so much, Doc.